Welcome to RSCH503, Research Methods and Biostatistics, a 3-credit graduate course offered by Drexel University College of Nursing and Health Professions. The third criterion of research design is, can the results be generalized to other participants, other groups, and other conditions? Two key considerations regarding this criterion are, first, the difference between basic versus applied research, and second, the difference between internal versus external validity. Applied research includes scientific investigations conducted to generate knowledge that will directly influence or improve practice. Basic research, in contrast, includes scientific investigations for the pursuit of knowledge for knowledge's sake, or for the pleasure of learning. Internal validity is the extent to which an investigator is able to say that no other variables except the one studied caused the result, or the extent to which the effects detected in this study are a true reflection of reality rather than being the result of the effects of extraneous variables. External validity is the extent to which study findings can be generalized from the sample to the population of interest. The fourth criterion of research design is, does the design address issues of internal versus external validity? Recall that very tight internal validity may jeopardize external validity. The investigator must balance internal with external validity. Remember the use of attribute variables, extraneous independent variables built into a study design as an identified independent variable or variables. Recall also post hoc analyses. These techniques add to external validity. Two sources of external invalidity include non-random sampling and interaction between the testing situation and the experimental setting or stimulus. Several sources of internal invalidity include history, maturation, instrumentation, and subject selection. Construct validity indicates the degree to which a study measures all aspects of the concept it purports to measure. This depends on the skill with which the researcher has conceptually defined and then operationally defined a study variable. There are several threats to construct validity as follows. 1. Constructs lack clarity in terms of conceptual definitions. 2. Constructs lack clarity in terms of operational definitions. 3. Mono-operational bias, that is, measuring the dependent variable only in one way, especially when it is a complex variable. 4. Interaction of different treatments, occurring when two or more independent variables are being tested. 5. The Hawthorne effect, discussed previously. 6. Experimenter expectancies. 7. Hypothesis guessing within experimental conditions. And 8. The novelty effect, that is, better performance at the beginning of data collection because subjects are excited to be participating. After reviewing the above slides, the elements of a good research design include 1. Controlling the environment. 2. Controlling the equivalence of subjects and groups. 3. Controlling the treatment. 4. Controlling the measurement. And 5. Controlling extraneous variables that may influence the dependent variable by 1. Random sampling. 2. Random assignment. 3. Homogeneity of subjects on one or more extraneous variables. 4. Heterogeneity of subjects to reduce the risk of bias. 5. Blocking, that is, inclusion of subjects with various levels of an extraneous variable. Controlling the number of subjects at each level of that variable along with random assignment to groups within the study. 6. Matching as described previously, and 7. Statistical control. There are 4 types of quantitative research designs. They exist on a continuum of causal inference. That is, these designs vary from very little control, example, descriptive design, to very tight control, true experimental design, example, randomized controlled trials or RCTs. Please recall that the strongest design, that is, the true experimental design, enables causal inference only. No design assures cause and effect relationships. Descriptive study design examines the characteristics of a single sample. The design identifies a phenomenon of interest and the variables within the phenomenon, develops conceptual and operational definitions of the variables, and describes the variables. Such designs provide knowledge of the variables and the study population that can be used for future research in the area. This figure illustrates a typical descriptive study design. Once the phenomenon of interest is identified, variables related to that phenomenon are also identified, both conceptually and operationally, and descriptive statistics are obtained on all variables. Inferential statistics are also used as appropriate. Results of descriptive studies may provide critically needed information in an area in which little research has been conducted. Such results may stimulate hypothesis testing, more tightly controlled studies. The comparative descriptive study design examines and describes differences in variables in 2 or more groups that occur naturally in a setting. Descriptive and inferential statistical analyses may be employed to examine differences between or among groups. Again, as with descriptive study designs, results from comparative descriptive study designs may stimulate hypothesis testing, more tightly controlled studies. The longitudinal design examines changes in the same subjects over time. Such designs are time-consuming and require significant resources to undertake. The area to be studied, the variables, and their measurement must be clearly identified before data collection begins. Management of data and subject attrition, data collection procedures, training of research assistants, and other aspects of this design must be carefully considered prior to the onset of data collection. Correlational study designs examine relationships among variables. Researchers can seek to describe a relationship among, predict relationships among variables, or test the relationships proposed by a theoretical proposition or a model. In all correlational studies, a sample must be chosen that fully represents the population of interest. Large samples are generally required. An example of a descriptive correlational study design is represented on this slide. In this figure, there are 2 research variables of interest, number 1 and number 2. Each variable is described both conceptually and operationally via reliable and valid instruments, and statistical correlations are then performed to examine a possible relationship between variables 1 and 2. Once the statistical findings are known, the investigator takes time to carefully explore the meaning of any relationship, and then may propose hypothesis testing research designs. Quasi-experimental research designs examine causal inference. This design was developed to provide alternative means of examining causal inference in situations not conducive to experimental controls. Such designs lack a comparison group and randomization. This design has been developed to control as many threats to validity as possible in a situation in which at least one of the 3 components of true experimental design, that is, randomization, comparison group or groups, and controlled manipulation of the treatment, is lacking. Due to these limitations, rival hypotheses are possible. Alternate rival hypotheses. These are hypotheses that provide an alternative explanation of cause in a study. alternative rival hypotheses undermine causal inference or causal interpretation. True experimental design is characterized by randomization, research-controlled manipulation of the independent variable, and researcher control of the experimental situation, including a control or comparison group. Randomization is an effort to control bias. It is not absolute truth. It is simply an unbiased method to allocate sampling units to the treatment conditions. How is randomization ensured? How are subjects selected? Perhaps the most common method of selecting a random sample is through use of a table of random numbers. Other methods, less commonly used, include the coin flip for treatment versus control group assignment and name drawing from a hat or other vessel. The classic experimental research design provides the greatest amount of control possible to examine causality or causal inference. To examine causal inference, the investigator must eliminate all factors influencing the dependent variable other than the cause, i.e., the independent variable being studied. Being controlled eliminates other factors. Essential elements of the classic experimental design thus include 1. Randomization, 2. Researcher-controlled manipulation of independent variable, and 3. Researcher control of experimental situation. Clinical trials research is defined as planned experiments designed to determine the efficacy of a treatment or independent variable in a study in which the experimental group receives the treatment and the control group does not. In such research, subjects in experimental and control groups are randomly assigned after it is determined that they meet inclusion criteria. The outcome measures in clinical trials are usually clinical events, laboratory test data, morbidity, or mortality. Phases 1 through 4 clinical trial categories have been developed specifically for testing experimental drug therapy. Randomized controlled trials, or RCTs, are the gold standard for determining the effectiveness of healthcare interventions. For example, the American Heart Association and the American College of Cardiology developed the 2013 guidelines for the treatment of blood cholesterol to reduce atherosclerotic cardiovascular risk in adults. These guidelines provide primary care providers with recommendations for practice based on data from randomized controlled trials. This presentation was prepared for graduate nursing students at Drexel University College of Nursing and Health Professions. The primary book used in this research course is the Practice of Nursing Research, Appraisal, Synthesis, and Generation of Evidence, 2017 edition by Jennifer R. Gray, Susan K. Grove, and Suzanne Sutherland. This book is published by Elsevier Saunders, St. Louis, Missouri.